We've already mentioned health vulnerability in the previous podcasts several times. This is a chapter that's focused on assessing climate and health vulnerability, so we'll just add a few more points in this short chapter. This is called a practical approach, so you have to basically worry about time scales, spatial scales, the major variables that go into determining health vulnerability in the context of climate change. Plus, you have to worry about how to project this vulnerability into the future. Right? Those are the few points we will make. So this figure from Christy Abbey's paper looks at the various issues that go into health impact. We have seen this in various different ways, but it never hurts to look at it again, especially in this context here. So the direct effects of climate change, which include storms, drought, flood, heat wave, and extremes and sea level rise and so on and so forth, affect both social dynamics and also they affect indirect effects coming through water quality, air pollution, land use change, ecological change, and so on. So we have seen each of these factors already in terms of health outcomes. And under social dynamics, we have age and gender, health status, socioeconomic status, social capital, public health infrastructure, mobility, and conflict status. So these are together going to determine health impacts, which include the range we have already looked at: mental illness, undernutrition, allergies, infectious diseases, cardiovascular diseases, injuries, respiratory diseases, and poisoning. Right? We talked about contact dermatitis and so on and so forth. And each one of these to compute vulnerability have to be considered for the translation of climate change onto health vulnerabilities, and of course that raises the question of quantitative and qualitative definitions of vulnerability, which means you need actual data and the links. Right, so doing past assessments of climate impact on health, as Tony McMichaels advocated, and how to define risk and vulnerability. Those are the kind of issues that go into it. And of course, vulnerability are going to be dependent on all these factors that we talked about: age, gender, and geography as well. So as an example, let's look at how urban environment impacts our health. Health conditions associated with air pollution, noise, heat, and lack of physical activity, and natural spaces, which typify crowded urban environments, are manifest into health effects, which are listed here. Those are the four: air pollution, noise, heat, lack of physical activity, and lack of natural space. These are five factors considered here for things that affect the head, so dementia, cognitive impairment, neurodegenerative diseases, mental health problems, stroke, cerebrovascular diseases, autism, and so on, breast cancer, COPD, asthma, pneumonia, lung cancer, myocardial infarction, arrhythmia, premature birth, reduced weight at birth, hypertension, and other general health issues, fitnesses, etc., like obesity, diabetes, metabolic syndrome, nuisance, stress, sleep disorder, and so on. Obviously, it's very easy to make a list of such outcomes related potentially to these, but vulnerability will require much more than just listing the potentially related outcomes. You need quantitative assessment of the links, and then how to translate that into metrics for vulnerability, because once you map vulnerability at required spatial scale, then you need to design policies, measures, and actions to reduce vulnerability, as well as make sure that the actions taken are continuing to reduce vulnerability and will take care of the future impacts of climate change on those vulnerability factors. So this also we have seen before, but let's revisit this again anyways. What are the determinants of vulnerability? Exposure is always a key, sensitivity and adaptive capacity, right? These are the things. Exposure is contact between a person and one or more biological, psychosocial, chemical, or physical stressors, including stressors affected by climate change. So climate change is a running theme for us, of course. Sensitivity is the degree to which people or communities are affected, either adversely or beneficially, by climate variability and change. Adaptive capacity is the ability of communities, institutions, or people to adjust to potential hazards. In this case, we would be worried about health hazards, to take advantage of opportunities, or to respond to consequences, right? So that leads to vulnerability of human health to climate change as a net effect, which determines the health impacts in terms of injury, acute and chronic illnesses, including mental health and stress-related illnesses that we have already looked at, developmental issues, and even mortality. Right? There are other details like dailies, daily adjusted, disease adjusted, disability adjusted life years, and so on, when you live with the health impact for a long time, and so on. So the main goal is then to not only define and quantify vulnerability, but then be able to do vulnerability and adaptation assessments. You need to frame and scope the assessment, which includes such steps in conducting a health, vulnerability and adaptation assessment, which is put out by WHO and has been modified by various authors along the way. So frame and scope assessment: assess, manage and monitor risk. Right? So again, mapping risk also means it's a way of tracking whether the actions are reducing the risks. Okay, and how the risks will change in the future as climate change continues to impact these factors that contribute to risk and vulnerability. So, defining the geographical region and health outcomes of interest, identifying the questions to be addressed and steps to be used, identifying the policy context for the assessment, establishing a project team and a management plan. Those are kind of practical steps. Establishing a stakeholder process where people who are under risk or vulnerable, for whom the policy and actions are being designed, actually are part of the process, because then the co-production of this assessment and framing is much more effective. If they're not involved, then they don't necessarily trust the process and may not participate as to effectively benefit from the process. Developing a communication plan, which is of course part of engagement and tracking the progress and assessment. Assessment includes vulnerability, so current burden of diseases. You must have a baseline where you know what is the current burden of disease, current health protection programs that are in place, future impacts, this is critical, changing burden without climate change, so you need some kind of a counterfactual baseline where if climate change wasn't changing the health burden, how would the health vulnerability change, and then how vulnerability is changing additionally because of climate change impacts on health. Projected health impacts of climate change. This is not very easy. We will look at a couple of issues here and in the next chapter as well. Adaptation. Identify and prioritize additional interventions. Identify resources and barriers to implementation. And then have an iterative process where you are looking at health harms and benefits in other sectors and how they affect future impacts and how they feed back to communicating plans and implementing the frame and scope assessment, monitor and evaluate and see how that affects adaptation plans currently and into the future. And so you can see these various interacting loops that are required under steps to conduct health vulnerability and adaptation assessment. Okay, so obviously these are concepts that are very important, and data is very critical, including people data, so surveys, registries, monitoring of monitoring environmental factors and health surveillance and so on, which we talked about before. So we'll add some more points in the next podcast and look at some of the future issues that need to be worried about as well when it comes to health vulnerability assessments. Okay.